Hello, dear readers. This is our project called Clinical Key of Electrical Stimulation in Physiotherapy and Rehabilitation. It is founded by the Erasmus program of the European Union. The project coordinator is represented by Pamukkale University from Denizli, Turkey, in partnership with University of Craiova from Craiova, Romania, Hatay Mustafa Kemal University from Hatay, Turkey, Başkent University, Ankara from Turkey, Süleyman Demirel University from Isparta, Turkey, Siuliai State University of Applied Sciences from Siuliai, Lithuania, Burdur Mehmet Akif Ersoy University from Burdur, Turkey. We have also in collaboration with the associations from Turkish Physiotherapy, Order of Physiotherapists in Romania, Lithuania Physiotherapy, and Estonian Association of Physiotherapists, all associations from their own country. My name is Eva Ilie, and I am an assistant professor. I'm representing the University of Craiova from Romania, and this paper is about galvanic current, and it states the module 2 of currents used for electrical stimulation. So current signifies the movement of electric charge, often facilitated by free electrons with material or circuit. It's quantified in amperes and involves the motion of charge carriers like electrodes, positive ions, and negative ions. For therapeutic purpose, it's advisable not to surpass intensity of 80 to 100 milliamperes. The application of the direct current of the therapy is termed galvanization or galvanism. So generating direct current can be achieved via chemical, mechanical, and thermoelectrical approaches. Galvanism denotes the utilization of low voltage and low amperage direct current in therapeutic contexts. Among the earliest forms of therapeutic electricity, galvanism can feature either a continuous or pulsed waveform and is contingent on the direction of electron flow. During galvanic application, the electrochemical reaction emerge at the poles of the circuit. So when electrons migrate towards the negative pole, they prompt physiological alternations at the application site. So the interaction plays a role in the therapeutic effect of galvanic current. Medical galvanism. Encompasses employing electric current to induce physiological modification within the tissue. An example is ionophoresis, wherein ionic medications are introduced into the tissue. So these techniques yield local electromechanical outcomes while also impacting the vasomotor system, thereby influencing blood and lymph circulation. However, using this approach necessitates sound knowledge, proper training, and caution application. It is imperative to look for or seek guidance from a qualified healthcare or a professional before using any therapeutic intervention involving galvanic current. For the electrotherapy devices, including galvanostats and pantostats, are designed to administer direct current for therapeutic utility. Leveraging semiconductors, these devices ensure to provide provision of well-filtered and consistent direct current with modulate current waveforms. In this progressive landscape, sophisticated devices provide an array of current types to cater to different therapeutic needs. So, therapeutic tailored to specific application. The selection of equipment should align with the manufacturer's recommendation. Therefore, equally important is to seek the guidance of a professional, qualified professional. Their experience ensure appropriate device usage, optimizing safety and effectiveness in the therapeutic intervention. As for the direct current application, the equipment includes a galvanic stimulator that is designed for galvanic current delivery with power source, controls, application electrodes, etc. For the electrodes, there are various sizes and shapes, pads, sponges, etc., made of conductive materials, and they are applied directly to the body. Conductive gel or electrode solutions are used for enhancing the conductivity and electrode skin contact management. For cables and connectors, they transmit current from the device to the electrodes. So for the features, the safety features that we all need, the current limiting circuits, adjustable intensity controls, built-in timers for safe application. For the mechanism of action and physiological effects, according to the usage of positive pole that is called anode and negative pole that is called cathode, we have electrochemical effects and physiological effects. In the case of electrochemical effects for the positive pole for anode, we find the fact that it attracts acids and oxygen, and for the negative pole, it attracts bases, alkaloids, and hydrogen. For physiological effects, in the case of anode, we find that it stops hemorrhaging, relieves acute inflammation, dehydrates, hardens the tissue, constricts arterioles, decreases nerve irritability. For the cathode, we find the increase of hemorrhage, congests and irritates tissue, relieves chronic inflammation, dilates arterioles, and increases nerve irritability. So the positive pole of galvanic current yields physiological effects akin to cold application, while the negative pole resembles to hot application. To attain the polar effect, two electrodes of different sizes are needed. So with the smaller one acting as the active pad, usually not exceeding half the size of the larger dispersive electrode. So under adhering the milliamp rule, users, the amperage density remains within 1 milliampere per square inch of the active electrode area. The smaller active pad yields more pronounced polar effect due to its higher current density, and compared to the larger dispersive pad. So to identify the negative pole and negative lead, an approach involves immersing the leads in salted water and gradually increasing the amperage until bubbles emerges at the leads. So the negative pole attracts positively charged hydrogen ions, causing the accumulation of numerous smaller bubbles distinct from the positive ions and lead. For the galvanic current, this can be used to drive charged ions and ionic medication into the tissue. So positively charged medication are delivered by the positive poles, while negatively charged medication are delivered by the negative poles. So the galvanic current primarily penetrates into the dermis corium layer, reaching a depth of approximately 1 millimeter. From there, the medication is dispersed through capillary circulation to a large area of tissue. So although the depth of current penetration and ion dispersal are relatively shallow, some believe that the field effect generates many impact ionic molecules of greater depth. We encounter here the physicochemical tissue changes. For the bioelectrolysis, ions are moving in an electric field. Ionophoresis, the ion transport through the tissue. Electrolysis compounds the composition into ions by the electric current. Electroosmosis, the fluid movements in tissue due to the electric field. For the membrane potential changes, it altered potential across cell membranes. For the neuromuscular excitability modulation, the effect on nerve and muscle excitability is found. Thermal effects is the heat from the current flow, and electromagnetic induction is inducting current via changing in magnetic field, and tissue composition changes for the alteration in chemical composition. For the physiological effects on the body, we have the sensory nerve fibers that are affected, motor fibers, central nervous system, and circulatory system. So the galvanic current causes tingling sensation with analgesic effect at higher intensity for the sensory nerve fibers. In the motor fiber, it enhances motor fiber excitability and is useful for muscle preparation. In the case of CNS, the galvanic current affects reflex activity and excitability, and it influences blood circulation that enters in the domain of circulatory system. In the year 1937, a study was conducted by Cordingley, and there were described two techniques known as general and central galvanization. In the case of general galvanization, one electrode was placed on the sacrum, while the other one was moved along the spine and extremities. This technique was meant to enhance the lymphatic circulation through the body. So the central galvanization follows the similar approach, but the stationary electrode is placed over the solar plexus, which is complex network of nerves located in the upper abdomen. The purpose of central galvanization was also to enhance the lymphatic circulation. So both of them, central and general galvanization, techniques are used to stimulate the lymphatic flow, which plays a crucial role in the immune system and the removal of waste and products and toxins from the human body. So these techniques are considered to be a part of the broader application of the galvanic current, and in naturopathic medicine to support overall health and well-being. For the following, in case of the medical galvanism, or the use of galvanic current modalities, employs the direct current to achieve specific therapeutic effects. So using current provides targeted and contralateral therapeutic effects to enhance patient outcomes. The modality offers, for example, several applications for muscle rehabilitation, the tissue healing and edema reduction, the ionophoresis, and pain management. In the case of muscle rehabilitation, galvanic stimulation can be used to aid in the rehabilitation of muscle that is injured or weak, or nerve injuries, affected by the nerve injuries. So by delivering a control current, it helps activate motor nerves and promote in this way muscle contraction, facilitating muscle re-education and strengthening. In the case of tissue healing and edema reduction, the galvanic current can promote tissue healing by improving local blood flow and oxygenation. So it also aids in reducing edema by facilitating the movement of fluids through the tissue and promoting lymphatic drainage. For the ionophoresis, targeted delivery of medication into the tissue through the skin is the important medical galvanization use. So the current enhances the transport of charged particles from the medication, allowing for a targeted and controlled delivery of this medication for localized therapeutic effect. In the pain management, galvanic stimulation has been used to manage pain by modulating the nerve activity and reducing pain signals. So this can help relieving various type of pain and releasing endorphins that will help with acute or chronic pain. For the effects in the case of muscle rehabilitation, we have the current, the effect of the current onto the motor nerve fibers. So all the negative pole, when it is used as an active electrode, the excitability threshold for the motor fiber decreases, so their excitability increases. It will therefore be possible to stimulate the motor fibers and cause contraction, of course. So studies have proven that the sudden decrease or increase in current intensity represents a significant and important stimulus, triggering a prompt response of the muscle contraction as the muscle contraction. So the stimulating action of the galvanic current on the motor nerve fibers is used in practice and is a preparation of the denervated muscle for the excitation currents. So at the negative pole, a decrease in excitation threshold is recorded with the same phenomenon of neuromotor stimulation with increasing excitability. In practice, for muscle rehabilitation, for example, in sciatic neuralgia, longitudinal lumboplantar electroplantic or transversal electroplanting on the sciatic is applied. So if the pain is only up to the thigh or calf, it should be applied on the lumbar, on one lumbar electrode, the other one on the back of the thigh or the outer side of the calf. So for cervical, for example, for cervical palmar galvanization is applied in neuralgia of the cervical brachial plexus. In myalgia, for example, neuromyalgias with different locations, we should place the pole, the positive electrode on the spine near the spine next to the neuromuscular segment that the negative electrode on the painful muscle area should be. Therefore, in neuropathic medicine, galvanic current and ionophoresis, galvanism and ionophoresis are indicated and used as an application for various conditions that include hepatic drainage for liver support and detoxification, in managing hemorrhoids, corn removal and treatment of indolent ulcers, cervicitis, rhinitis, hay fever, otitis media. Also, it is used as a treatment for dysmenorrhea, abscesses, amenorrhea, for bronchitis, colitis. It's also applied as an aid in resorption of adhesions, reduce swelling, manage various inflammatory conditions. It's used as an adjunct therapy for conditions like migraines, neuralgia, for impotence, for arterial strictures, or toothaches. All this application demonstrates the wide range use and possibilities and potentials of the use of galvanic treatment in naturopathic. In the application methods, we use plate electrodes. These are flat electrode pads that are placed directly on the skin, and of course, according to the desirable therapeutic effects, they are positioned with positive and negative adjustments taking in consideration the desired effect. So electrolytic and galvanic bath for immerses the body part or the whole body in the electrolyte field bath and applying galvanic current through submerged electrodes. A partial 4-cell galvanic bath. This also immerses specific body parts in separate compartments. Within multi-cell bath, each with an electrode and electrolyte solutions, allowing, of course, stimulations targeted with galvanic current application to different areas of the body. For ionophoresis, transcutaneous delivery of medication using galvanic currents will be used with the electrodes directly on the skin and the medication applied to the treatment area. So galvanic current will transport the medication, as we talked before, into the tissue. We now have reached the safety measures and precaution and contraindication part of the galvanic current treatment. The milliamp rule refers to avoidance of current intensity, excessive current intensity to prevent burns and discomfort among the skin of the patient. Allergic sensitivity, we should always check if the patient is allergic before treatment with ionic substances. Broken skin, we do not place the electrodes directly on the skin if there is damage of skin or it's a broken skin. This should be, we should make sure that it's clean and intact. Electronic implants, we should definitely be careful and avoid the application of the treatment and the electronic implants for the electronic implants like pacemakers or neurostimulators. Impaired pain sensation. We should be very careful of impaired pain sensation as neuropathy because we will not have an accurate feedback if there is lacking of sensibility. So therefore, to adjust with all of these rules, we should definitely have an individual assessment of the patient with the medical history and proper application techniques that will ensure safety in galvanic current therapy. So the consult with a physician and a physiotherapist for a suitable treatment and safety measures is for sure implied. These are the references that helped forming this presentation. This is our beautiful theme, and I want to thank you all for your attention and for your patience.